Science and Physics and graduated from the Naval Nuclear Power School. He served 5 years as a submarine officer, and he is presently CEO of Prime Okay, there we go. Enterprises, Inc., a company that he co-founded. He has been a member of Queen City Toastmasters for 7 months. He is going to give speech number 5, your body speech. And just to give you a little bit about the different speeches, each speech, you have 10 speeches that you have to complete in Toastmasters. And Vincent is on number 5, and each of these speeches have different areas that you want to target. So your body speaks, and we're going to bring up Mr. Vincent Seville.
Fellow Toastmaster guests, tonight I'm going to talk to you about a very important topic. A topic that affects us all, and it affects us through our whole life, healthcare. Specifically, healthcare reform. 4 years ago, in 2010, President Obama and the 111th Congress passed the Patient Protection and Affordable Care Act. And why did they suddenly do this? Why did they want to revamp the healthcare system after all these years? Well, one was to try to greatly reduce the number of uninsured Americans and to really try to bring costs down in the healthcare system. Healthcare has been rising 5 to 7% every year just to administer it. And has anybody spent night in the hospital or had a family? If you look at the bill and then you look at the insurance, it's pretty expensive. In fact, sadly, most of us would go bankrupt if we had a serious health condition and didn't have health care. So they passed this law, and it's a 906-page document. You can Google it. I downloaded it. I'm sure a lot of you go home and read it tonight. Now, I'm going to give you a clip notes. I'm going to tell you what you need to know in a short thing. I'm going to tell you what it is, why it's legal according to the Supreme Court, what the financial implications are, how's it going to hit your pocket, and what some of the challenges are. Okay, first, what is it? It's 4 things. 4 things you have to remember. You're going to get a whole bunch of information from all kinds of healthcare companies coming this year and your employer, because in January 1st, this takes effect next year. Okay, first, any company over 50 employees has to provide health care to their employees or pay a penalty. So they can choose not to do it, but they'll pay a penalty. So if you're 50 employees or more, they are going to have to provide health care. Okay. 2, on January 1st, 2014, every person or every American that pays taxes or is above a taxable income must have health care or they pay a penalty. You pay it directly to the IRS if you do not have health care. 3, if your company doesn't provide you with health care because they decide to pay the penalty, or they're under 50 employees, or you're an independent consultant, they will set up exchanges, federal and state exchanges, where you can go out and purchase health care. So you can go out and you'll have United Healthcare, Blue Cross Blue Shield, and you can go pick a plan that suits you or your family. And finally, the 4th point in this 906-page article that really gets into the meat is that no healthcare company can deny coverage to you for a pre-existing condition anymore. You cannot be denied coverage no matter what. That's the four big tenets of the health care. Now, why is it legal? Well, it went all the way up to the Supreme Court, and a lot of people challenged it. And what the challenge was is kind of the broccoli principle. Can you force someone to buy something? Let's say broccoli is good for you. Can the United States government pass a law that says, I think broccoli is good for you, so you need to buy broccoli and eat it 4 times a week? That was the premise they went up against. And the Supreme Court said, yeah, well, we agree. We can't force you, but constitutionally, we can tax you. So that's how they upheld it. They said, okay, if you don't pay health care premiums, you're going to pay it directly to the IRS. So it was very controversial, but that's how it passed the Supreme Court. So it was upheld legally. So it is going to go into effect at this point. Now, what's the penalty? If you do not have health care and you don't pay premiums, you will pay 2.5% of your adjusted adjusted gross income in 2014. So when you do your 2014 taxes, if you do not have health care, if you can't prove you have health care, you will pay 2.5% of your income. Pretty easy to do, just go straight to the IRS. Now,
Is that, can we ask questions? I'm not sure.
No.
No, you can't.
so 2.5% of your income will go directly to the IRS. Now, I did say that there were some challenges with this, and there are. One of the big challenges is there's a lot of thought that a lot of healthcare companies may go out of business. And the reason for that is now they have to insure people they normally wouldn't insure, and they can't deny them coverage. So we're going to have to let it go through a couple of years, they've said, 5 see if it actually drives down the prices at this time. So we'll have to see that. The second thing that is there's a lot of angst among a lot of the people who brought the challenges that a lot of the younger people who don't make a lot of income will just pay the penalty. Now that's good for them, but think about this. Let's say they suddenly have a life-threatening illness. They cannot be denied coverage at that point. So they can go, they haven't put any money into the Blue Cross or Blue Shield. They can go, let's say they in a car accident, and that health care provider will have to cover those costs. Well, that's great for them. However, everybody else who's in Blue Cross and Blue Shield or whatever, our premiums could go up. So there's some loopholes. There's definitely some loopholes that they're going to have to figure out how to seal them up so that the law works better. What I will say is it's not perfect. It really isn't, but it's a start. It's something our country has to get a hold of. We have to, get healthcare under control. And it's necessary so that you, me, and everybody else in this room, and all Americans and our children can live happy and healthy lives and not worry about financial ruin if they have a medical condition. Mr. Toastmaster?